Good day, everyone. We are the Group 1. I am Crystal Claire Agustin, the leader, and we will now be discussing our answers in Worksheet 4, which is entitled Cardiovascular and Lymphatic System.
Of blood. Number 1. What is the blood volume of an average sized adult? In an average sized adult, we have 5.5 liters. And number 2. What determines whether blood is bright red or dull brick red? Depending on the amount of oxygen that is carrying, we can differentiate whether is blood is bright or it is dull brick red. Number 3. Use the key to identify the cell types or blood elements that fit the following description statements. Some terms may be used more than once. So in number 1, its name means neutral loving a phagocyte. It is a phagocyte. So our answer is neutrophil. Number 2, what are the granulocytes? These are the neutrophil, ionosotophil, and basophil. Number 3, also called as a red blood cell. It is the erythrocytes. Number 4, agranulocytes. These are the lymphocyte and monocyte. Number 5, ancestral cell of plates, which is megakaryocyte. Number 6, these are the basophils, eosinophils, erythrocytes, lymphocytes, megakaryocytes, monocytes, and neutrophils, and all examples of this are deformed elements. Number 7, number rises during parasite infections. This is called eosinophil. Releases a vasodilator, the least abundant of white blood cells. This is the basophil. What transports the oxygen? This is erythrocyte. Number 10, primarily water, non-cellular, or fluid matrix or blood. The keyword is neutrophil. Number 11, phagocyte in chronic infections. These are the monocytes, lymphocyte, neutrophil, basophil, and eosinophil. Well, number 4, list 4 classes of nutrients normally found in plasma. Our answer is amino acid, glucose, fatty acid, and vitamins. These are found in nutrients that is found in plasma. Well, the two gases. Two gases are carbon dioxide and oxygen. Name 3 electrocytes. The 3 electrocytes is sodium, potassium, and calcium. Number 5. Describe the consistency and color of the plasma you observe in the laboratory. Well, the plasma is slippery. This is described as slippery. Gelatinous fluid straw-like color, which is yellow. Number 6. What is the average lifespan of red blood cell? How does its enucleate condition affect this lifespan? Well, the duration of development is about 15 days. Lifespan is 109 to 120 days. Because it is a nucleate, they are unable to reproduce or repair damage because it during circulation. Let's move on. Number 1, the eosinophil, which represents 2% to 4% of leukocytes. Its nucleus, which is generally figure 8 or bellow bed in shape, and its large cytoplasmic granules, which is elaborate lysosome strain, red-orange with right strain. So our answer is eosinophil. Number 2, it is a neutrophil, represents 50% to 70% of the leukocyte population. Typically, their nucleus consists of 3 to 7 lobes, and their pale lilac cytoplasm contains very fine cytoplasmic granules which take both of acidic and basic dyes, which is a neutrophil. Number 3, it's observed the smallest of leukocytes, which is approximately the size of a red blood cell. Notice the large blue to purple, generally spherical of lightly indented nucleus. Lymphocytes. It is the lymphocytes. The rarest of the White blood cells, a basophil which represents 0.5% to 1% of the population. Notice its large U or S-shaped nucleus and its core space granules that strain deep purple with bright stain, which are the basophils. And number 5, the largest of the leukocytes is approximately twice the size of red blood cells. Monocytes represent 3 to 8% of leukocytes. The dark blue nucleus is generally kidney shaped and its abundant cytoplasm strains grade blue, which is the monocytes. Okay, number 8. Correctly identify the blood pathologies described in column A by matching them with selections from column B. So in number 1, abnormal increase in the numbers of white blood cells, we have leukocytosis. Number 2, abnormal increase in the number of red blood cells, we have polycythemia. Number 3, condition too few red blood cells of RBCs with hemoglobin deficiencies, the anemia. Number 4, abnormal decrease in number of white blood cells, which is leukopenia.
For, for hematologic test, number 9, broadly speaking, why are hematologic studies of blood so important in the diagnosis of disease? To make an accurate diagnosis and effective treatment as possible. For number 10, there are record the information from blood tests you conducted. Since we didn't do blood test, ano, we only get the normal values and the significance. For total white blood cell count, it for its normal values, it's 11,000 cells per millimeter cube. For the total RBC count, normal values is 5 million cells per millimeter cube. For hematocrit, the normal values is 42% to 49%. Hemoglobin determination, the normal values is 14 to 16.5 grams per milliliter. The coagulation time for normal values is 9.6 to 11.8 seconds. If the if the white blood cell count is high, its significance is severe bacterial infection will cause an elevation in white blood cells and in white blood count due to rise in neutrophils. If it's low values, the cause is leukopenia. The total RBC count, its high values, the body increases RBC to compensate for hypoxia. Its low values is decreased RBC count. For hematocrit, the high values is affected by hydration, loss of plasma relative to RBC, elevated HCT. Increased HCT indicates true increase in red blood cells. For its low values, it can cause by over dehydration or a true decrease in RBC HCT. HCT immediately after blood loss will be normal. Within a few hours, plasma volume normal but decreased RBC but cause decreased HCT. For hemoglobin determination, the high values causes hypochromic or too much H2B pigment, and for low values, hypochromic. Too little HGB pigment is seen in disease with abnormal types of HGB that are fragile. For coagulation time, its high values is greater than 30 seconds, place clients at significant risk of bleeding. For its low values, typically not significant unless comadin. Next, number 11, define hematocrit. Hematocrit Hematocrit is a packed all volume or percentage of total blood volume occupied by RBC. If you had a high amount of hematocrit, would you expect your hemoglobin determination to be high or low? The answer is high. Why? Because the body will produce too much RBC. If your blood clump with both antigen A and antigen B sera, your ABO blood type would be AB. To what ABO blood groups could you give blood? From which ABO donor types could you receive blood? You can receive blood from A, B, AB, and O. Which ABO blood types is most common? The most common blood type is O, and the least common is AB negative. Explain why an Rh negative person does not have a transfusion reaction on the first exposure to Rh positive blood but does have an reaction on the second exposure. Because it takes time for the body to react and start making antibodies. However, the second time the antibodies react and rupture the donor's Rh positive RBC. Next, what happens when an ABO blood type is mismatched for the first time? The immune system becomes sensitive and begins to produce antibodies against foreign blood types. Number 15. Assume that blood of two patients has been typed for ABO blood type. On the basis of these results, Mr. Adam has O blood and Mr. Calhoun has A blood. Could Mr. Adams safely receive a blood transfusion from Mr. Calhoun? The answer is no. Could Mr. Calhoun receive safely a blood transfusion from Mr. Adams? The answer is yes.
We are in anatomy of the heart. First, we have brachiocephalic trunk. The, the brachiocephalic trunk or brachiocephalic artery or innominate artery is an artery of the mediastinum that supplies blood to the right arm and the head and neck. Next, we have supervena cava. The superior vena cava is a major vein in your upper body. It carries blood from your head, neck, upper chest, and arms to the heart. Now we have right pulmonary artery. Next, we have ascending aorta. Below it, we have pulmonary trunk. Next, we have right pulmonary veins and right atrium. Below it, we have right coronary artery. Next, we have right ventricle. And next, we have inferior vena cava. For the left side, we have left common carotid artery. Is a large elastic artery which provides the main blood supply to the head and neck. Next, we have left subclavian artery. Is the fifth branch of the aorta and the third branch from the arc of the aorta. Next, we have ligamentum arteriorum. Under it, we have left pulmonary artery. Next, we have left pulmonary veins. Next, we have auricle of left atrium. Next, we have left coronary artery. Lastly, we have left ventricle. And next, we have apex. Now, for the function of the pericardial disc, it lubricates the heart, allowing the heart to beat in a relatively frictionless environment. And that's all for anatomy of the heart. Match the terms in the key to the descriptions provided below. First, we have drain blood into the right atrium. And our answer is coronary sinus. Number 2, we have superior heart chambers, and our answer is atria. Number 3, we have inferior heart chambers, and our answer is ventricles. Number 4, visceral pericardium, and our answer is epicardium. Number 5, receiving chambers of the heart, and our answer is atria. Number 6, layer of composed of cardiac muscle, we have myocardium. Number 7, provide nutrient blood to the heart muscle. The answer is coronary arteries. 8, lining of the heart chambers, epicardium. 9, actual or pumps of the heart, we have ventricles. Now, what is the function of the valves found in the heart? And our answer is they enforce a one-way blood flow through the heart chambers. 5, can the heart function with leaky valves? And our answer is yes, but not efficiently as long as the impairment is not too great. A leaking valve does not close properly. Therefore, it enables blood to flow backward into the left atrium, and leaking valve might cause cardiac failure if left unchecked. Lastly, what is the role of the chordae tendae? Our answer is the function of chordae is to pull the walls of the ventricles inward during contraction. Ano?
Hello and good day, everyone. I am Ryan BAGASLAO, and I will be reporting about the pulmonary, systemic, and cardiac circulations. So, for number 7, a simple schematic of a so-called general circulation is shown below. What part of the circulation is missing from this diagram? So, the missing circulation is the pulmonary circulation. And for the completion of the diagram, first is the veins enters the blood enters the veins in the heart and then passes through the pulmonary arteries and and it enters the lungs, then the pulmonary capillaries, then the pulmonary veins, and then goes back to the heart again, and then which the heart from the heart it will travel through the rest of the body. So for number 8, differentiate clearly between the roles of the pulmonary and systemic circulations. So the pulmonary circulation functions only for gas exchanges that takes place in the lungs, in which blood gains oxygen and loses carbon dioxide, while the systemic circulation transports the oxygenated blood to the other parts of the body, as well as returning the deoxygenated blood or the unclean blood containing the carbon dioxide back to the heart. So for number 9, complete the following scheme of circulation in the human body. So first, blood passes through in the right atrium through the right atrioventricular valve to the right ventricle, then through the pulmonary the semilunar valve to the pulmonary trunk to the pulmonary arteries to the capillary beds of the lungs, then to the pulmonary veins to the left atrium of the heart. After that, it passes through the mitral valve to the left ventricle, to the aortic semilunar valve, and to the aorta. Then from the aorta, it passes through the systemic arteries to the capillaries, the systemic tissues of to the systemic veins. And then lastly is it passes to the inferior vena cava and superior vena cava entering the right atrium of the heart. For number 10, if the left atrioventricular valve does not close properly, which circulation is affected? The affected circulation is the systemic circulation. Number 11. Why might a thrombus, blood or blood clot in the anterior descending branch of the left coronary artery cause sudden death? Um, Since cardiac muscle, since cardiac muscle is involuntary, blood supply will always be constant. The cardiac cells are arranged in spiral or figure eight-shaped bundles. When the heart contracts, its internal chambers become smaller, forcing the blood upward into the large arteries leaving the heart. Hindi ako answer. Pwede na ikat.
Alright, take your time. Makat mo muna.
So for number 11, why might a thrombus blood clot in the anterior descending branch of the left coronary artery cause sudden death? This is because the blood clot would block the passageway of the blood, causing the oxygen delivery to be shut off in the left ventricle, thus preventing the blood circulation process. For the microscopic anatomy of the cardiac muscle, add the following terms to the photo of the cardiac muscle at the right. The first table is the intercalated disc. They play vital role in bonding cardiac muscles and in transmitting signals between cells. Next, next label is the nucleus of cardiac muscle fiber. It houses all of the genetic cell's genetic material. And the third is the striations. It focuses us to generate force and contract to support the pumping of blood throughout the body. And lastly is the cardiac muscle fiber to cause mechanical motion of pumping blood. For number 13, what role does the unique structure of cardiac muscle play in its function? Since cardiac muscle is involuntary, blood supply will always be. The cardiac cells are arranged in spiral or figure eight-shaped bundles. When the heart contracts, its internal chambers become smaller, forcing the blood upward into the large arteries leaving the heart. This structural feature, plus the special arrangement of cardiac muscle in the heart, allows the pumping of the heart to be carefully coordinated for maximal efficiency.
For the anatomy of the blood vessels, microscopic structure of the blood vessels, number 1, use the key choices to identify the blood vessels tunic described. Take note that some choices may be used more than once. So number 1, we have most internal tunic. The answer is tunica intima. Then the bulky middle tunic. The answer is the bulky middle tunic contains smooth muscle and elastin rather. The answer is tunica media. Then number 3, its smooth surface decreases friction. The answer is tunica intima. Number 4, tunic of capillaries. The answer is tunica intima again. And number 5, tunic or tunics of arteries and veins. We have tunica intima, tunica media, tunica externa. Number 6, tunic that is especially thick in arteries. The answer is tunica media. Number 7, we have the most superficial tunic is the tunica externa. Okay, number 2, servicing the capillaries is the basic function of the organs of the circulatory system. Explain this statement. So the answer, or the explanation rather, is that the capillaries are vital for the effective transport of O2 throughout the body, making them a crucial component of the circulatory system. For it to be short, they transfer oxygen to the cells. Number 3, cross-sectional views of an artery and of a vein are shown below. Identify each by labeling the appropriate leader line. Also respond to the related questions that follow. First question rather. Which of these vessels may have valves? The answer is the veins. Then which of these vessels depends on the elasticity to propel blood along? The answer is arteries, and which depends on the skeletal muscle pump and changes during breathing. The answer is veins rather, because blood pressure is inadequate to return blood to the heart after it has managed to pass through capillaries and into veins. This is where skeletal system and valves in veins help push blood back to the heart. Moreover, breathing causes a negative pressure in our thoracic cavity. The thin walls of veins aid in the transmission of pressure changes to blood. Number 4, why are the walls of arteries relatively thicker than those of the corresponding veins? So, it's because they have a high blood pressure and must alter their diameter to maintain blood pressure and control blood flow. Arteries have thicker walls for easier compression of skeletal muscle and a greater effect on blood flow from breathing.
And veins of the body. 1. The arterial system has one of these. The venous system has two. Answer is bronchocephalic. 2. This artery supplies the myocardium. The answer is coronary. 3. The more anterior artery pair serving the brain is the internal carotid and vertebral. 4. Longest vein in the body, great stephanus. 5. Artery on the foot check after leg surgery is the dorsalis pedis. 6. Serves the posterior thigh. The answer is deep femoral. 7. Artery supplying the diaphragm. Phrenic. 8. Formed by the union of the radial and ulnar veins. Answer is bronchial. 9. Two superficial veins of the arm is basilic and cephalic. 10. Artery serving the kidney, renal. 11. Testicular or ovarian vein is gonadal. 12. Artery that supplies the distal half of large intestine. The answer is inferior mesenteric. 13. Drains the pelvic organs and lower limbs. Internal iliac. 14. What the external iliac vein drains into the pelvis? The answer is femoral. 15. Major arteries serving the arm. The answer is bronchial. 16. Supplies most of the small intestine. Superior mesenteric. 17. What the moral artery becomes at knee? Polyteal. 18. An arterial trunk that has three major branches which run to the liver, spleen, and stomach. Answer is celiac trunk. 19. Major artery serving the skin and scalp of the head. Answer is external carotid. 20. Two veins that join, forming the polyteal vein, is the anterior tibial and posterior tibial. 21. Artery generally used to take the pulse at wrist. The answer is radial.
Now for number 6, we can see the human arterial system. The human arterial system is composed of arteries, which it carries blood away from the heart. And arteries are colored as red. It is because it carry oxygen and nutrients away from your heart to your body's tissue. So as we can see on the slide, it has indicated labels for the arteries. Slide, Nick. Now for the second diagram on the slide, so we can see the venous system. So the venous system refers to the network of veins that work to deliver the oxygenated blood back to your heart. So veins are a type of blood vessel that returns the oxygenated blood from your organ. So it is colored as blue as it because it takes oxygen for blood. So we can see there are the indicated labels for the organs in our venous system. Now for this slide, now we will be now talking about the traces of blood flow for the following situations. So letter A is it is from the capillary beds of the left thumb to the capillary beds of the right thumb. So capillary bed is a simply a network of capillaries in which it supplies an organ. The more metabolically active the cells, the more capillaries required to supply nutrients and carry away waste products. So for letter A, it blood flow of the capillary beds of the left thumb to the capillary beds to the right thumb composed first from the digital vein to the left radial, left brachial vein, left axillary, left subclavian vein, left brachiocephalic vein, superior vena cava, right atrium, right ventricle, goes to the pulmonary trunk, pulmonary artery, digital artery, lobar, pulmonary capillaries of the lung, pulmonary veins, left atrium, left ventricle aortic arc, brachiocephalic artery, right subclavian artery, right axillary artery, right brachial artery, and lastly, it will now go to the right radial artery. So for the letter B, we have the from the pulmonary vein to the pulmonary artery. So pulmonary means something that affects the lungs. So the blood flow tell us the blood trace that carries oxygen and other nutrients from our lungs to our vein, so to our brain. So it's blood flow is from pulmonary vein, left atrium, left ventricle, aortic arc, brachiocephalic artery, right common carotid artery, right internal carotid artery, right middle cerebral and right anterior cerebral arteries, capillary beds, dural sinuses, internal jugular vein, brachiocephalic vein, superior vena cava, right atrium, right ventricle, and lastly for the pulmonary trunk until it reaches its pulmonary artery. So for the special circulations, which part one is the pulmonary circulation. So it traced the pathway of a carbon dioxide gas molecule in the blood from the inferior vena cava until it leaves the bloodstream. So inferior vena cava is a large blood vessel responsible for transporting the oxygenated blood. So for its blood flow, it tells about from the inferior vena cava to the right atrium, tricuspid valve, right ventricle, pulmonary semilunar valve, pulmonary trunk, right or left pulmonary artery, lobar artery, pulmonary capillary beds in lungs, and lastly to the air sacs or the alveoli of lungs. So next is for number 9, trace the pathway of oxygen gas molecule from an alveolus of the lung to the right atrium of the heart. So its blood flows is from alveolus to the alveolar capillary walls, pulmonary vein, left atrium, bicuspid mitral valve, left ventricle, aortic semilunar valve, aorta, systemic arteries, to the capillary beds of tissues, systemic veins, superior or inferior vena cava, and lastly to the right atrium. As we can see, there are encircled structures in the circulation for number 9. So encircled structures is where gas exchange takes place. As we can see, we talk about the blood flow in our lungs. So the encircled structures are the where gas exchange take place. So for number 10, so most arteries of the adult body carry oxygen-rich blood, and the veins carry oxygen-depleted carbon dioxide rich blood. So how are the pulmonaries and veins are different? So the arteries carry oxygen for blood to the lungs, whereas the pulmonary veins carry oxygen rich blood from the lungs to the left atrium of the heart, as what I have said earlier in the discussion. Next is for the hepatic portal circulation. So number 11, what is the source of blood in the hepatic portal system? As we said, hepatic portal system, it is the venous system which composed of veins that return blood from the digestive tract and spleen to the liver. So it talks about the blood flow happening in our digestive system. So source of blood in the hepatic portal system is blood drained from the digestive viscera. So the digestive viscera are the internal organs that function to digest food, mostly composed of our liver, gallbladder, and pancreas. So next is why is the blood carried to the liver before it enters the systemic circulation? It is because our blood are rich in nutrients, and the liver is the key organ responsible for maintaining proper blood concentrations of glucose, proteins, etc. Its phagocytes also cleanse the body of debris. So number 13, the hepatic portal vein is formed by the union of it is fill in the blank. So the hepatic portal vein is formed by the union of the splenic vein, in which drains the spleen, pancreas, and greater curvature of the stomach, and the superior mesenteric vein via the inferior mesenteric vein, which drains the small intestine and ascending colon. The gastric vein, which drains the lesser curvature of the stomach, empties into the hepatic portal vein. So lastly, so we will now trace the flow of drop of blood from the small intestine to the right atrium of the heart. So its blood flow is first capillaries of the small intestine. Next is the superior mesenteric vein, hepatic portal vein, liver sinusoids, hepatic vein, inferior vena cava, and lastly, the blood will reach to the right atrium of the heart.
For arterial supply of the brain and the cerebral arterial circle, number 15, branches of the internal carotid and vertebral arteries cooperates to form a ring of blood vessels encircling the pituitary gland at the base of the brain. What is given to this communication network? The answer is circle of Willis. The function of this is to cause blood to continuously flow anteriorly and posteriorly to the brain even if its feeding vessels is clogged. Number 16, what portion of the brain is served by the anterior and middle cerebral arteries? The answer is the back of the cerebrum. Number 17, trace the usual pathway of a drop of blood from the aorta to the left occipital lobe of the brain. Noting all structures through which it flows aorta, the answer is left subclavian, left vertebral basilar, left posterior cerebral, and left occipital lobe. For the fetal circulation, we have number 18, the failure of two of the fetal bypass structure to become obliterated after birth can cause congenital heart disease, which the youngster would have rather improperly oxygenated blood. Which two structure are these? Answer is the foramen oval and ductus arteriosus. Number 19, we have for each of the following structure indicate its function in the fetus. Circle the blood vessel that carries most oxygen-rich blood. So, for the structure, umbilical artery, it carried the oxygenated, heavily loaded waste blood to the placenta for exchange. For the umbilical vein, we have it carry oxygenated, heavily loaded nutritious blood to the fetus. Then the ductus venosus, it allows most of the umbilical venous blood to enter the inferior vena cava. Then the ductus arteriosus rather, it allows most of the outflow from the right side of the heart to pass through lungs to aorta. For the foramen oval, it is the opening hole between the right and left atria. It allows shunting of some blood away from the right ventricle. For number 20, what organ serves as a respiratory, digestive, excretory organ for the fetus? The answer is placenta.
Once again, I am Ryan Edward and I will be reporting the human cardiovascular physiology, blood pressure, and pulse determinations. For the cardiac cycle, number 1, the aortic pressure is the one which is labeled letter I in the diagram. For number 2, um, letter K in the diagram is the atrial pressure. And number 3 is the letter M that you can see in the diagram is the ECG. Number 4, first heart sound is the letter O. Number 5, second heart sound is letter P. For number 6, ventricular pressure left is letter G. And while for number 7, the volume is letter F. Number 8, aortic semilunar valve process is the letter H. And the aortic semilunar valve opens is letter L for number 9. Next is number 10. AV and semilunar valves are closed. These are the letter B and letter D. Number 11. AV valve closes. That is letter J. Number 12. AV valve opens is letter L. For number 13, ventricular diastole are the letters A and E. And lastly, ventricular systole is letter C. So define the following terms. Systole is the ventricular contraction or the contraction of the heart chambers during which blood leaves the chambers. Diastole is defined as ventricular relaxation or the relaxation of the heart chambers during which they fill with blood. Cardiac cycle, it is the complete run of cardiac systole and diastole. For number 3, answer the following questions concerning events of the cardiac cycle. When are AV valves closed? It is closed during ventricle systole, and it is open during atrial contraction and ventricular diastole. What event in the heart causes the AV valves to open? It is when the relaxation of the ventricles and continuous filling of the atria, and it is closed when the ventricular contraction causes high pressure in the blood in the chambers causing the AV valve. When are semilunar valves closed? It is closed during the period of relaxation of the heart as a whole and during atrial contraction, and it is open during ventricular systole. What event causes the semilunar valves to open? It is when ventricular pressure is greater than the pressure in great arteries. It is also closed when ventricular pressure is lesser in great arteries. At what point in the cardiac cycle is the pressure in the heart the highest? It is when it is at the ventricular systole, while it is lowest at the ventricular diastole. If an individual's heart rate is 80 beats per minute, what is the length of the cardiac cycle? The length of the cardiac cycle is 0.75.
So now let's discuss the human cardiovascular physiology, which is the heart sounds. So 5, complete the following statements. The monosyllables describing the heart sounds are lub and dub. And the first heart sounds that closures of the AV, AV valves and semilunar. Okay. Valves or eyes. The first sound result of the AV valves and semilunar valves, whereas the second is a result of the beginning systole and AV valves. The heart chambers that have been filled with when you hear the first heart sound are the end of systole and semilunar valve. And the chambers that have just emptied are the mitral and tricuspid valve immediately after the second heart sound. The atria and ventricle are the filling with blood, and the ventricle and atrium are empty. Number 6. As you listen to the heart sounds during the laboratory session, what difference in pitch length and altitude loudness of the two sounds did you observe? So first heart sound is longer, louder and lower in pitch than the second heart sound, which is short, sharp and high pitch. 7. No one expects you to be full-fledged physician on such short notice. But on the basis of what you learned about heart sounds, how might abnormal sounds be used to diagnose heart problems? In number 7, abnormal heart sounds called heart murmurs, which is very abnormality caused when you check on someone's heart. Because the sounds include rasping, whooshing, or blowing sounds. A normal heart is should sound love and dub. A heart murmur is an extra sound in heartbeat that is caused by turbulent flow through the heart valves. That is causes these abnormalities that causes the heart sounds cause different. Identifying abnormalities can solve a heart because a normal heartbeat should sound love and dub and not murmur because on the difference. I can help or we can help the patient with heart problems by identifying the sound of their hearts. Defining pulse. Okay, the term pulse refers to the altering surges of pressure in artery that occur with each beat on the left ventricle. Normally, the pulse rate equals the heart rate and the pulse averages to 70 to 76 beats per minute and the resting rate. And number 9, identify the artery palpitated at each of the following pressure points. At the wrist, we have the radial pulse. In the front of the ear, we have temporal. In the groin, we have dorsalis pedis. And on the dorsum of the foot, we have carotid. At the side of the neck, it is called the femoral. Above the medial malleolus, we have tibial. Number 10. How would you tell by simple observation whether bleeding in arterial or venous? Okay, it's a simple definition or a simple instruction. If it spurts, it is an arterial. It will flow evenly if it is a venous blood. That is the identification. That's all. Thank you.
Blood pressure determinations. Now for number 11, define blood pressure. Pressure impaired to the blood by left ventricle to get it to flow throughout the body. Number 12, identify the phase of the cardiac cycle to which each of the following apply. Systolic pressure and diastolic pressure. Now, our answer is systole and diastole. Number 13, what is the name of the instrument used to compress the artery and record pressures in the oscillatory method of determining blood pressure? And our answer is sphygmomanometer. And number 14, what are sounds of Korotkov? And our answer is Sounds made by the blood spurting in artery as the pressure is released in the cuff. Pressure in cuff drops just lower than systolic pressure, allowing some spurting flow. Pressure in cuff less than diastolic pressure and no more disturbance of flow. Number 15, interpret 145 and what 185. I mean 85. 145 mmHg systolic and 85 mmHg diastolic. Napay 16 uy.
Sorry lang, God.
Number 16, they should be much lower. Why? Because pressure in arteries is dissipated as blood goes through capillaries. For observing the effect of various factors on blood pressure and heart rate. Number 17. What effect do the following have on blood pressure? Number 1. Increase diameter of arterioles. And our answer is D. Number 2. Increase blood viscosity. Number 2. I. Number 3. Increased cardiac output. And our answer is I. Number 4. Hemorrhage. And our answer is D. 5. Arteriosclerosis. Our answer is I. 6. Increased pulse rate. Our answer is I.
Number 18. In which position, sitting, reclining, or standing is the blood pressure normally the highest? Standing. The lowest, reclining. What immediate changes in blood pressure did you observe when the subject stood up after having been in the sitting position or reclining? So your blood pressure is higher when your heart is hard at work, pumping blood while your body is moving, keeping balance, etc. When you are awake and standing, and when you are reclining, your heart is at rest and doesn't need to work as hard to pump blood throughout the body. What changes in blood vessel might account for the change? Blood vessel can feel the shear stress caused by blood flow. When the shear stress increases, the blood vessel response at diameter became larger. Thus, in short, changes in blood flow might cause blood vessel to change diameter. After the subject stood for 3 minutes, what changes in blood pressure did you observe? So the blood pressure even out back to normal to 3 minutes for blood to be distributed normally to and from the heart to body. How do you account for this change? Decreased activity of sympathetic nervous system. 19. What was the effect of exercises on blood pressure? It increased the blood pressure. On pulse, it increases the pulse. Do you think these effects reflect changes in cardiac output or in the peripheral resistance? So this effect reflects changes in cardiac output. Skin color as an indicator of local circulatory dynamics. 20. Describe normal skin color and the appearance of the veins in the subject's forearm before any testing was conducted. So the skin pink, veins flat and difficult to see. Next is 21. What changes occurred when the subject emptied the forearm of blood by raising the arm and making a fist and the flow was blocked with cough? So the skin became pale, cyanotic in some cases, and cool.
Number 5, the lymphatic system. Lymphatic system functions is to protect the body from the illness. For number one, shows the main structures indicated using the key choices listed. On the up on the head, we can see the palatine tonsil, submandibular nodes, cervical nodes, and the right lymphatic duct. On the left part, the thoracic duct, the left subclavian vein, axillary nodes, lymphatic vessels of the upper limb, lymph follicles of the small intestine or the Peyer's patches. Next is the iliac node. On the right portion, we can see the right subclavian vein, thoracic duct, cisterna chyli, intestinal node, large intestine, and the inguinal node. On the on number 2, color and label the spleen, red bone marrow of the right femur, and the thymus gland. The red part is the spleen. Next, the blue part is the thymus, and the orange part is the red bone marrow. For number 3, list the three main functions of the lymphatic system. Number 1, forms an elaborate drainage system that picks up excess tissue fluid. Next, the defense system of the body, and lastly, the fat transport.
Now we're gonna discuss the lymph and lymphatic vessels. So number 4, which important constituent of blood is absent from lymph? We choose number B, which is the erythrocytes. What is the difference between lymph and interstitial fluid? Well, it is interstitial fluid bats the cells and lymph is found in the lymphatic vessels. And their answer is letter C. Which nutrient is absorbed into the lymphatic vessels of the small intestine? Which is the fats? Number 7. Which of the following does not contribute to lymph flow? The the following that does not contribute to lymph flow is the construction of adjacent skeletal muscle. The thoracic duct empties lymph into the sub subclavian duct. Number 9. Which of the following lacks a network of lymphatic vessels? Which is the brain and cornea. Let's move on into the completion. The instruction is the following paragraph describes lymphatic vessels. Complete it by scoring out the incorrect option and bold leaving the correct options. So, the smallest lymphatic vessels are called ducts, venules, or capillaries. So, first is we choose capillaries. So, the smallest lymphatic vessels are the capillaries. One significant difference between and the smallest vessels is that they are only have permeable walls. In the in their function is to drain in the lymphatic containing white blood cells away from the interstitial spaces. Most tissues have network of these tiny vessels, but one notable exception is the fatty tissue. The individual tiny vessels join up to form larger ones, which now contain four layers of tissue in their walls. Similar veins into the cardiovascular system, the inner lining at the endothelial layer covers the bulbs, which filter the lymph, filter the lymph. As vessels progressively unite and become wider and wider, eventually they empty into the biggest lymph vessels of all, the thoracic conduct and the right lymphatic duct. Okay? And the first one of these drains are the right lymphatic duct, which is the second drains in the left side of the body, and left side of the body, and the second drains is in the upper body above the pelvis, side of the body or side of the body. So that's all for the completion.
For part 5, we have the labeling and coloring. And as you can see, we have the picture of the section of a lymph node. So number 11, the figure 6.2 shows the internal structure of a lymph node. Label the structures indicated and color the capsule and associated trabeculae. So we have here the right in at the right part rather. We have the capsule, reticular tissue, efferent lymph vessel, the efferent, efferent lymph vessel at hilum of node, or hilum rather, then the lymphatic tissue. So for the left part, we have the afferent lymph vessel, lymph flow, valve, trabeculae, then afferent lymph vessel. So number 12, on figure 6.2, insert arrows to show which way lymph will flow through this lymph node. So the the vessels here at the left part rather, it is where lymph flows into node through these vessels, and then it it goes out, or it flows out of the node through this only wide vessel at the right part of the picture. Then number 13, on average, lymph flows through how many lymph nodes before returning to the bloodstream? The answer is 23. 23 is the major lymph nodes.
Question number 14. What are the main types of tissues that make up a lymph node? These are letter C, reticular and lymphatic tissue. Number 15. Which important protective cells are found within lymph nodes? Our answer is letter A, which is the lymphocytes and the macrophages. Number 16. Which of the following statements is true concerning the structure of a lymph node? Our answer is letter B. Each, uh, each node has several apparent vessels but only one apparent vessel. Next, which is the main group of nodes draining the arm? Letter B again. It is the axillary nodes. For number 18, define the term phagocytosis. Phagocytes are cells that protect the body by ingesting harmful foreign particles, bacteria, and dead or dying cells. Lymph nodes filter and clean lymph. List four types of particular matter that are removed from the lymph. So these are the bacteria, viruses, cancer cells, and cell debris. Next, what happens to organic bacteria phagocytosed in the lymph nodes? As a consequence of phagocytosis in mammalian phagocytes involves nutrient uptake that is necessary for lipid-mediated signaling. What happens to inorganic materials phagocytosed in the lymph nodes? Neutrophils and macrophages cannot phagocytize phagocytize naked bacteria, viruses, or other pathogens.
Matching for each of the following key choices, decide whether it applies to the lymph nodes, the spleen, or the thymus, and complete table 6.1. So for the characteristic of lymph nodes, spleen, and thymus, so for spleen, it is the largest lymphatic organ. It stores blood. Red blood cells destroyed here. It lies immediately below the diaphragm, synthesis, red blood cells in the fetus, and phagocytosis, cellular debris. So for the thymus, it is where T lymphocytes mature, site of multiplication of activated lymphocytes, made up of two narrow lobes, maximum weight usually 30 to 40 grams, at its maximum size at puberty, lies immediately behind the sternum and secretes the hormone thymosin. And for the lymph node, it is its bean shape, distributed throughout lymphatic system. It filters lymph, oval in shape, and size from pinhead to almond size.
Now for the lymphatic system, as you can see the figure, that is the thymus gland and associated structures. Now for the color violet, we have thyroid gland. For color gray, we have trachea. For the sky blue, we have right lobe of thymus. For orange, we have right lung. For dark blue, we have left internal jugular vein. For peach, we have left common carotid artery. For red, we have left subclavian artery. For blue, we have left subclavian vein. For sky blue, we have left brachiocephalic vein. For white, we have left lobe of thymus. For orange. For orange, we have left lung. And 25,
For number 25, mucosa-associated lymphoid tissue or mouth. The answer is B. Tonsils are made up of lymphatic tissue. And letter D. For number 27, aggregated lymph follicles or Peyer's patches are found in the C. Gastrointestinal tract. And number 28, thymosin, letter C, is an essential cofactor in antibody production.
For the last part, we in the deep dive part, we are assigned a performance task on how to check your central and peripheral pulses using your finger pads and stethoscope if it is available. So we produce a small video clip presenting our demonstration for the following movements: temporal, carotid, apical, or use of stethoscope if available. 4 is for brachial, radial, popliteal, dorsalis pedis, and posterior tibial.
Good day, everyone. My name is Crystal Claire Agustin, and today I will demonstrate how to find the temporal pulse point and the posterior tibial pulse point. To find the temporal artery, you'll need to find the landmarks. The temporal artery comes off the external carotid and goes up. And you'll need to find the tragus of the ear, which is located in here. And the zygomatic arc, which is commonly known as your cheekbone. So your pulse site, where this X is found, right here is your temporal artery. So this includes your temporal pulse point, which belongs to pulses in your head. Now, we're gonna locate the posterior tibial pulse point. So this is found on the inside of the ankle, found between the back of the medial malleolus, which is the bony prominence of the ankle bone, and Achilles tendon. So you'll find it within this area right here, where the X is located. This is your posterior tibial pulse point.
The carotid. First locate the trachea and slide laterally to find the carotid pulse.
Hi, good day. I'm KRYL ASUMBRADO, and today I will going to perform to how to assess the apical pulse. First, introduce yourself to the patient and verify the patient's identity. Next, explain to the patient on what you are going to do and provides patient privacy and do the hand washing. In locating the apical impulse, first is to palpate the angle of Dewey just below to the suprasternal notch. Next, slide your middle finger just to the left of sternum and palpate the second intercostal space. Then, place your middle finger in the third intercostal space and continue palpating downward until you locate the fifth intercostal space. After that, move your finger laterally along the fifth intercostal space toward mid-clavicular line. After locating the apical impulse, next is to auscultate and count the heartbeat. First, using alcohol swab, clean the diaphragm of your stethoscope and also the earpiece. Next, warm the diaphragm by holding it in the palm of your hand for a moment. Next, to tap the diaphragm to ensure that it is the active side, then place the diaphragm over the apical impulse and listen for the normal sounds. If the rhythm is regular, count the heartbeats for 60 seconds to provide accurate assessment. Lastly, place the patient in a comfortable position and document the findings.
So hi, this is YVANA, MEMEBERS, and today I'll be showing you how to locate our brachial artery pulse point. So first and foremost, this pulse point is usually used in assessing blood pressure to our patients and to someone. So first we have to locate our cubital fossa, which is this area or this triangular area in front of your elbow. And then the brachial artery is located at the top of the cubital fossa. So use your index finger and middle finger to feel your brachial artery if it is normal, or if the pulse rate rather is normal, absent or weak, or irregular ba or regular.
Hello and good morning everyone. So I am Ryan BAGASLAO, and today I will be showing to you on how to check our radial pulse or how to do the radial pulse assessment. The radial pulse is actually one of the most common used styles to check our pulses, since it is much easier to locate, which is convenient for both the examiner and the patient. So how do we check the radial pulse? First step is to locate first the pulse. So the radial pulse can be found at the wrist area, just below the base of the thumb. Then, use your three fingers and just press lightly to feel the beat. The second step is to count the number of beats per minute. To shorten the process of counting the beats per minute, you can just actually count the number of beats for 10 seconds and then multiply it by 6 to make it equivalent to a 1 minute duration of beats. And lastly, the normal pulse rate for healthy adults should range from 60 to 100 beats per minute. So those are the process of checking the radial pulse. That's all, thank you.
Everyone, in this clip, I'm gonna show you where is the crucial pulse point, so let's get going. So first to find is the popliteal pulse point, which is located behind our knee. To find the pulse point, we need to bend or flex the knee and both hands behind the knee. Why? Because we need to find or to search the middle area of our popliteal fossa, diamond-shaped hidden area behind the knee, helping bending the knee can find it. So by finding our pulse point, we just need to bend our knee, and in the middle area we need to go further and we can feel it by touching it. That's all, thank you.
Hi, my name is John BERNADAS, and now I'm going to execute on how to find the posterior tibial artery and your dorsal pedal pulse. Let's begin. Now, these sites are assessed during your head-to-toe assessment, especially if your patient might have peripheral vascular disease or if they had a vascular procedure like a heart cath where they access the femoral artery. So first, we have posterior tibial artery here. To find the posterior tibial artery, you must locate first the malleoli. So here is our malleoli, and move dorsal to it. Remember to keep a light touch so that you can locate the pulse easily. So here is her pulse. Now at this rate, you can rate her pulse. Now next, we have dorsal pedal pulse. In order to locate the dorsal pedal pulse, you must see first the first ray or the first metatarsal bone, which is here. Now if you lift this up, you can see the bone right up here, the first bone, and now you go to the highest point of this bone. Now you can relax and move a little bit to the middle and look for the pulse. And now this is our pulse. At this moment, you can rate this pulse.